Hello everybody, I'm Greg and I wanted to make a short video for you on what are some of the ways that you can better make a decision on the health insurance company that you decide to go with for you and your family. Now this video is most helpful I think for newer employees, but really any employee in the federal government can use this site and use these filtering tools to narrow down the options that you have in choosing a health insurance company. I say it's more catered for new employees because for new employees, this is probably one of the most difficult decisions they have to make because working for the federal government, you are probably going to see more options for healthcare insurance than any other employer's ever offered you. Okay? So again, I'm going to hopefully help you narrow those things down. And I might even, and towards the end of the video, I want to show you some ways to filter through them, but also to see which plans. And I don't want to say they're going to save you money, but they might save you some money. Because one of the things that we've grown to see is some of these companies, right, these health insurance companies also have a little bit of dental. Some of them even have a little bit of vision insurance. And the reason why I say that might help you save some money is because of a federal employee, you are offered health insurance, but you're also offered insurance plans for dental separately and vision. So if you could find a health insurance plan that meets you and your family's needs, well, maybe that you don't have, and it has no dental coverage, maybe you don't need separate dental insurance. Or maybe if it has a little bit of vision insurance and you and your family have issues with their eyes, frequently buy new glasses, maybe you don't need separate vision insurance if your health insurance plan is pretty well rounded. So let's just jump into it, okay? And if you're watching this video, I suggest you watch it maybe on your phone or a separate computer. But we're going to start at Google and we're going to search the letters OPM. OPM stands for the Office of Personnel Management, and it's the first link right there. I'll walk you through this. It's opm.gov to be specific. And for those of you that are not aware, the Office of Personnel Management, it is the human resources office for the entire federal government. Every federal agency all over the country and some offices around the world, okay? And we are going to focus on insurance. So if you go to insurance, hover over it. If you look right here, there's an FEHB plan comparison tool, and that's the tool we're going to use today. Go ahead and open that up, okay? We're comparing plans for 2023. I'm shooting this video in December of 2022. So with that said, zip code. Now, I'm going to put the local zip code to our medical center, which is 89086. You can certainly put the zip code of where you live, and it'll narrow it down. Now the other options, we are going to select the first option here because we are federal employees, and this one's for federal and U.S. Postal Service employees. And I like to select, in terms of pay frequency, I like to select bi-weekly. And the reason why that is we are going to get paid bi-weekly, and the premium that's coming out for your health insurance will also be deducted bi-weekly. Okay, but if you are a monthly budgeter and all that, hey, by all means, do what select what works for you best. But for right now, let's go and select the number one option for federal employee and bi-weekly. Okay. Now, if you are a current employee and you want to compare these plans to your current plan, you can use this option here. I'm going to go ahead and not do that right now because most new employees, you have no federal government employee insurance plan. Okay. So let's go ahead and search. And from here, you are going to see a long list of options. This is that list that can be very intimidating, very frustrating. It's one of those things it's a double-edged sword where it's a blessing because you have a ton of options, but then it also can be a burden because you're like, oh my goodness, where do I start sorting these things? So I'm going to show you how to hopefully narrow them down. We go to the top. We're going to use this filtering tool here in a second. But before we do, let me go over some of these columns so that we're all on the same page, okay? So when you look at these plans, I'm just going to give you a brief overview. You'll see here the plan name of the plan you're going to select. And please pay attention. You might want to write this down. You might want to save this on your phone somewhere, take a note. When you make the final selection of the plan you want to use, every plan has a 3-digit code underneath it. It's called the enrollment code. You are going to need that code to enter into the paperwork when you're selecting your health insurance plan. So pay attention to that, okay? Enrollment code. Now, employee premium, this is what you're gonna pay. And we selected, if you remember from our filtering in the screen before this, we selected bi-weekly. So bi-weekly, this is what you're gonna be charged, okay? Now, if I could take a time out, one of the things the new people may not know this is when you select a health insurance plan, you will pay a little bit of a premium. Actually, what happens is you will pay 25% of the actual premium, and the United States federal government will subsidize it, paying the rest of the 75% of the premium, okay? But you're not gonna see that dollar amount, okay? What you see here is what you will pay, so this already is the 25%. That is what's gonna come out of your check every 2 weeks, okay? Now your annual deductible here, you'll see is $2,000. And guys, if you don't understand some of these industry terms, I struggle with them myself, deductible. Remember the little I under these columns stands for information. So if you don't know what an annual deductible is, click on the letter I, and a brief description or explanation will come up of what an annual deductible is, okay? If this is not good enough for you and you want a little bit better understanding, what I recommend is drop that term, annual deductible, health insurance, drop it into a Google search so you can read up and have a more thorough understanding. But if you just need a quick reminder, if this suffices for you, great, you can move on. But just know those information buttons are always there. Your out-of-pocket maximum, this is the maximum dollar amount based on what your deductible is, which you'll pay out of pocket. This is the most amount of money you will pay every year, and then from then on, your insurance will cover everything else that should happen in a catastrophic or traumatic situation, right? $7,500, okay? If your plan does qualify for a health reimbursement account or a health savings account, that's what HRA and HSA stand for. It'll indicate it here, okay? And then from here, you'll start to see the levels of coverage, right? For primary care, specialty office visits, so on and so forth. We have information on medication, right? Generic or brand name medication and what they cover for that. And then also, we'll talk more about this. I won't use terms like PPO or HMO and all that. It'll talk about if the plan requires a referral or not, okay? So let's jump into this. Let's see what's important to us. Let's go ahead and click the filtering tool right here. And we can make some selections. Again, our goal is not to hit a bullseye. We're gonna narrow this long list down. So for example, let's start, I like to start with numbers and members. So let's say you are a couple, right? A married couple, so it's you and your spouse. So we're gonna unselect self and family. We are allowed to self plus one, so that's me and my spouse. If me and my spouse had children, we would go ahead and select self plus family, okay? But for now, the sake of this exercise, let's do self plus one, okay? Another one that's very important to people, plan requires a referral. Some of us say, I do not want to have to get a referral to go see some type of subspecialist. Why? In this day and age, it's gonna take me 4 months to get an appointment with primary care, and even then they gotta write the consult. Now I gotta wait another 4 months to see this dermatologist or urologist or a cardiologist. So some people want a plan where they say, no, I don't want to require a referral. So we're gonna say no there. Premiums, now we can talk about dollars. You could look at your budget and say, the premium I wanna pay every 2 weeks. I guess this is not working for me. I don't know what's going on here. Okay. Hopefully it's working for you. Let's go ahead and jump here to annual out-of-pocket maximum. So we can look here at the most. This might tie into your emergency fund, how much money you save in your rainy day fund. So let's say we want an out-of-pocket maximum of $6,000. So no matter what catastrophic should happen, I don't want to have to pay over $6,000 out of pocket, okay? Now let's see our list. We'll see how the list narrowed down, okay? So we have Aetna, Blue Cross, Compass Rose, GEHA. GEHA, by the way, guys, if you really look it up, it's an entity of Aetna, a little bit more popular brand name. So we have a little bit more narrowed down. So guys, when you look at these plans here, some of you might be able to narrow it down from here based on the dollar amounts that are given here in the coverage. But if you want a little bit more details, let's try and select. We can compare side by side up to 3 companies. So let me at random, let me go ahead and select Aetna. I'll select one of these, Blue Cross, and maybe this MHBP standard value. Let me select that. So I selected 3 companies. Now I'll go all the way to the bottom and hit compare plans. From there, side by side, you'll see this is the column for Blue Cross. This is the column right here for the MHBP, and then Aetna's right over here. Okay, so you'll look at this now. As we scroll down, let me make this a little bit easier to understand. Right, as we scroll down, you'll see some general information on these codes, and we'll track it. Now, one of the things I don't like about this filtering tool, remember, we selected self plus 1, right? A married couple. But when you look at this and you select the plans, they go ahead and give you the one, see the little symbol here for single people, married with children people, and couples. So it's like, I didn't ask for all that. All I wanted was this, right? So you just got to be careful of that. Unfortunately, that's one area that's a little bit confusing. So let's go down, right? So when you compare the plan side, bi-weekly premium, so every 2 weeks, this plan I could expect to pay $142 and change, $80 and change, or $143, right? So big difference between these two. These two are pretty close. If this is a very, very important option for you, right? You might want to look at one that's a little bit cheaper. Okay. So again, now I was looking at that. Remember, see, you got to be careful. This was single. I want to look at for the couple, right? So 318, 185, right? So these two are way ahead of this one. That doesn't mean it's better. It just means it's cheaper. Let's keep looking down. Okay, so right here, annual deductible. Now let's be a little more cautious. Let's go back to self plus 1, annual deductible, right? So this is the money we'd have to pay out of pocket. Now, you'll notice now these columns are separated in 2. This is for you going for a provider that's in network, annual deductible, and out of network, right? So if you look at that, you can look at the deductibles if this is a deal breaker for you or something that's very important for you. You can go all the way down. It shows you what is your coverage or lack thereof coverage when it comes to primary care, specialty care, emergency use, what's gonna be covered, right? Surgical procedures, you can see that here. Here's some of your tests, right? Your labs and x-rays, what's that gonna cost you? Prescription drugs, if you're a person who needs specific generics or specific brand names, this might weigh very heavily for you, right? Now, one of the things I mentioned earlier is that, kind of earlier in the video, is that some of these companies do have a little bit of coverage for dental or vision, and let's see if the ones we chose do have any of that. This is where you're gonna find it. Go towards the bottom of the list. Oh, there you go. There's dental. So for dental, for adults, preventative. So preventative, these are your 2 cleanings a year, your 1 x-ray, your 1 exam a year. So this plan, yes, look, it does has coverage, but these 2 don't. All right. Preventive for children, we mentioned in our example, we don't have any children, right? Now, for adults, restorative. For restorative, these are your fillings, right? So these are the things that are going wrong and you're trying to correct. Now, as you can see here, for adults, none of these plans cover that. Okay, well, we didn't kind of expect that. We would expect some, maybe just some preventative or routine stuff that's covered, right? So we mentioned that this plan right here, I forget which plan this is. I think this is Blue Cross. This is one of the more expensive ones, but hey, look, it has dental coverage. This other plan here was very similar in price. This was the cheapest, but look at this one has dental, that one doesn't. Okay, let's keep moving down. Dental, I think we kind of fall off from the dental. Major restorative, this is probably your crowns and root canals. Yeah. Now let's go to vision. Okay, so vision's here. So your routine eye exams, wait a minute. These 2 don't cover, but this one does cover routine eye exams. Okay, that might be helpful, right? Or maybe let's say routine eye exams or eye exams for medical conditions. I don't take my word for this. Medical condition or non-surgical treatment. I think of this as a little bit of vision coverage for the people that already have glasses or already have a diagnosis of having some eye issues. all of them have coverage. See that? So you may not, if you read into the details of the contract, you may not have to get several vision coverage, because all these plans have a little bit of coverage. So that's pretty good. So guys, those are just some examples. I'm not going to go on and on about it, but again, this is how you would do that. If I can go back, you can mix and match and maybe unselect and reselect some different options. So you could use that. And again, guys, you could use that filtering tool. I don't know why my filtering tool wasn't working over here. Maybe, I don't know, who knows why. But hopefully you don't have that issues. And again, guys, if you do struggle with the terminology, I do too. I don't speak insurance. You do have a little bit of a summary if you click on the I button for information, and I'm not just Google it. Okay. With that said, guys, I hope you make a good decision that's right for you, so you're not getting too little coverage, but you're not getting over coverage, and the amount you're paying is affordable according to your family's needs and your family's budget. Have a great day.